And welcome back. Most people are familiar with chemotherapy to treat cancer, but the side effects can be awful.
That's true. Molly had the chance to chat with an expert and breast cancer survivor about a new test, and that test will determine if chemo is even necessary.
About 260,000 women will be diagnosed with breast cancer this year. Many of those women will be treated with chemotherapy, but according to our next guest, the majority of those patients will receive no benefit from chemo. So what are the other options, and do those treatments actually save lives? Dr. Ruth Oratz, a clinical professor of medicine at NYU, joins us to answer those questions, along with Jennifer, a breast cancer survivor and advocate. Good morning, ladies.
Good morning. Good morning.
We appreciate you joining us. Let's talk first about early stage breast cancer. How do you define it?
Early stage breast cancer is the kind of breast cancer that most women in the United States will be diagnosed with, particularly if you're going for your annual screening mammogram or a checkup with your doctor. And that's why screening is so important, because that's when we find breast cancers that are small, limited to the breast or those local lymph nodes.
Until now, how has it generally or typically been treated?
Well, until recently, we felt that the majority of women, even with early stage breast cancer, needed to receive chemotherapy in addition to surgery or whatever other treatments. But now, with the results from a new study using the Oncotype DX test, we can identify the people who will receive the greatest benefit from chemotherapy. That's probably about a third of patients. And the other 2/3 of patients with early stage breast cancer don't need chemotherapy. And that's a big change from where we were a decade or two ago.
It's a big change, and I would think it would have to be encouraging to patients and their doctors, because people know that there are so many painful, difficult side effects that come with chemo.
Well, that's true. Chemotherapy has its short-term side effects and long-term consequences, and quite honestly, a great cost to the healthcare system. So if we can spare everyone that treatment who doesn't need it, then that's a win-win. Of course, for the people who need the chemotherapy, we now know that we're targeting patients who will have an enormous benefit from treatment. So if your doctor still recommends chemotherapy for you, please understand that that's a good recommendation and that treatment is giving you a major benefit.
And doctors, is the testing good to determine which women need chemotherapy versus a different type of treatment?
Absolutely, and that's what this latest study has confirmed for us. It's yet another really important piece of data combined with information we've been gathering over the last 10 years, specifically using the Oncotype test. Very reliable, very predictable, and really helps us to determine who are those individuals who are going to benefit from chemotherapy.
Jennifer, how long ago were you diagnosed? Because you were diagnosed with the early stage breast cancer, correct?
Correct. I was diagnosed 8 years ago at age 36.
Do you have any concerns about the treatments that you were prescribed, that they used to treat your breast cancer?
No, I mean, I think when anyone is diagnosed, they are overwhelmed with learning the language of cancer and trying to understand how to make the right decisions for them. I had a great doctor, and that helped guide me towards taking this test, understanding what the results meant, and it was the right choice for me. It's different for everybody.
So you actually used the test that we're talking about today?
I did.
And did it end up that you needed chemotherapy?
Nope, not for me. I had a very low score, and so therefore took the route of hormone therapy instead of chemotherapy.
Wow, that's wonderful. Good for you. How about your recovery from breast cancer and now the likelihood of recurrence? What do you know about that?
Fingers crossed that's not something I need to tackle in life, but I'm doing great. Since my diagnosis and my treatment, I have dedicated myself to all young women who are diagnosed with breast cancer, and now am the CEO of the Young Survival Coalition.
That is wonderful. Good for you. I'm so happy to hear that your treatment went so well and that you had a good recovery and that your prognosis looks good. Doctor, where can people go to find out more about this test and to get more information about the options available to them if they are diagnosed with breast cancer?
For more information about the Oncotype test and whether or not it's appropriate for you, and for information about treatment decision-making, go to mybreastcancertreatment.org.
Wonderful. Great talking to you both. Thank you so much, ladies.
Thank you,
Thank
Molly.
you.